Welcome to AMCI's 30 and 30, where AMCI instructors bring you 30 minutes of powerful, interactive instruction, followed by 30 minutes just for you to ask questions, get clarification, and deepen your understanding. This is a MCI's way of opening direct access to our instructors, giving you the chance to learn, apply, and get real-time guidance from the experts. Your success is our focus, and AMCI 30 and 30 is here to help you code with confidence, accuracy, and skill. So get your coding manuals and get ready for your instruction. It begins now.
Hello coders, welcome back to another 3030 YouTube session brought to you by AMCI. I'm really excited about today's topic because we will be discussing two very important and commonly performed procedures from the Integumentary chapter. Lesion excision procedures as well as laceration repair procedures. First, let's read the copyright. CPT Copyright 2025 American Medical Association, all rights reserved. CPC is a registered trademark of AAPC. AAPC content found within this presentation is a copyright of AAPC. Keyword concept FTR Chun, AMCI Fab 7, AMCI ICD-10 Flip Tap, and MCG are the trademark of AMCI. The credential CPC, CRC, COC, CPMA, CPB, CPPM, CPCO are owned by AAPC. AMCI do not own right to these credentials. The credential CCA, CCS, CCS-P, RHIA, RHIT are owned by AHIMA. AMCI do not own right to these credentials. Both excision of lesions, benign or malignant, and repair of the laceration, which includes the simple, intermediate, and complex, falls under the Integumentary section of the CPT manual. Before we dive deeper into the CPT codes, let's start with the basic. What is a laceration? So a laceration is a wound caused by tearing of the soft tissue. It usually happens from the trauma, such as cut, a sharp object, or an accident. And laceration can vary from small superficial cut to deep jagged wounds that involves multiple tissue layers. And the term repair simply means a process of closing that wound to restore normal structure of the skin and the underlying tissue, also to promote healing and prevent infection. So, the wound closures are performed utilizing the sutures, staples, or tissue adhesives such as cyanoacrylate, either singly or in a combination with each other or in a combination with adhesive strips. So repair codes ranges from 12001 through 13153, and the repairs are classified into three types. Number 1, simple repair. Number 2, intermediate repair. And finally, complex repair. Okay coders, now let's take a closer look at three different types of the laceration repair. So first comes is a simple repair. And a simple repair is exactly what it sounds like. The closure of superficial wounds. These involve the epidermis, the dermis, or the subcutaneous tissue only, and no deeper tissue structures such as fascia, muscle, tendon, or bone are involved here. So a simple repair requires only one layer closure. And next we are going to look at the intermediate repair. And intermediate repair wounds are those that require more than a simple closure. Yes, these wounds involves a layered closure, meaning the provider repairs the subcutaneous tissue, the superficial fascia, plus the skin. Okay, so these wounds requires more than a single layer closure. and they also involves a limited undermining, and the single layer closure of heavily contaminated wounds requiring extensive cleaning also falls under an intermediate repair. And finally, we have complex repair, and complex repairs goes beyond the intermediate repair, and these are the wounds that demand special technique or extra effort to achieve proper closure. And here are the key features to watch for in the documentation. Exposure of the critical structure such as bone, cartilage, tendon, or a named neurovascular structure. Extensive undermining, debridement of the wound, involvement of free margins like vermilion border of the lip, helical rim, or the rim of the nostril. Finally, the complex repair involves the placement of retention sutures as well. Alright coders, now that we have covered the type of laceration, let's look where you will actually find them in the CPT manual. So simple laceration repair codes ranges from 12001 through 12018, and these codes are further classified into two groups or two main ranges based on their anatomic location and the size of the wound repair performed. The codes from 12001 through 12007 codes for a simple laceration repair performed on the anatomic location such as scalp, neck, axilla, external genitalia, trunk, and or extremities, including the hand and feet, while the code series 12011 through 12018 is for the repair of the face, ears, eyelids, nose, lips, and or mucous membrane. Now, intermediate repair codes are classified into three main groups or ranges. The code series 12031 through 12037 is for an intermediate repair on the location scalp, axilla, trunk, and extremities. But it is important to note that 12031 through 12037 does not include the hand and feet. And next we have code series ranging from 12041 through 12047, which is coding for intermediate repair on the locations neck, hands, feet, and external genitalia. Finally, the code series 12051 through 12057 is for intermediate repair on the locations face, ears, eyelids, nose, lips, and mucous membrane. And for complex repair CPT codes, we have four main code ranges based on their anatomic location and wound length. The codes 13100 through 13102 is for complex repair of the trunk. The code series 13120 through 13122 is for a complex repair of scalp, arms, and legs. The code series 13131 through 13133 is for complex repair of forehead, cheeks, mouth, neck, axilla, genitalia, hand, and feet. And 13151 through 13153 is specifically for complex repair of eyelids, nose, ears, and lips. So next, let's look at the facts to remember our FTRs. Number one, add multiple wounds from the same body area and same complexity. Different complexity and body area, use modifier 59. Cauterization and wound closure using adhesive alone is bundled and they cannot be coded separately. You have three classification of laceration repair: simple, only skin and subcutaneous tissue are repaired; intermediate, skin layers down to fascia, no muscle, a single layer with heavy contamination and limited undermining is performed. Complex repair, it includes intermediate repair of the skin layers, including the bones, tendon, cartilage, debridement of the wound edges, and also involves extensive undermining. Finally, decontamination or debridement are coded separate if significant. Okay, coders, now let's move on to the next topic for the day. Excision of the lesions, benign versus malignant. So the excision of lesion code series ranges from 11400 through 11606. An excision is defined as a full thickness removal of a lesion, including the margins. So excision codes are generally classified based on the type of the lesion, whether they are benign lesion or malignant lesion, as well as based on the size of the excised diameter. So benign lesions are non-cancerous lesion, and the excision procedure codes ranges from 11400 through 11446, while malignant lesions are cancerous lesion and their code series ranges from 11600 through 11606. And if you notice here, you can see that the code series starting from 114 is exclusively for benign lesion excision procedure, and the code series starting from 116 is for a malignant lesion excision procedure. So this is an easy step or easy tip for identifying whether the lesion code is for excision of benign or a malignant lesion. So another important topic or point which you have to keep in mind is that you have to code according to the body area and the size of the lesion. So also you have to code for each lesion's excised, which means you cannot combine the excised diameters of two lesions and then code. You have to code for each of them of the lesions excised separately. And also don't forget that repair by intermediate or complex closure should be reported separately, which also means the simple, that is non-layered closures, are included in the excision procedure codes when performed. When coding for the excision of the lesion, it's very important to know the size of the lesion excised, because CPT code selection depends on that measurement. So how do we measure it? The total excised diameter would be the sum of the lesion diameter plus the most narrow margin required on the both sides. Now you might ask, what is a margin? Margin means the smallest amount of normal tissue that must be removed around the lesion to ensure it's excised completely. And the exact margin is based on the provider's judgment. Also, the measurement of the lesion plus margin should be made prior to the excision. Now, let me explain to you how the excised diameter is calculated with the help of an example. So here, the provider documents a lesion measuring 0.2 cm diameter and with a margin of 0.1 cm on the both sides. So as per our formula, total excised diameter would be the lesion diameter plus the margin. So that would be 0.2 cm for the lesion diameter and 0.1 cm plus 0.1 cm for the margins on both sides. And after calculation, the final total excised diameter of the lesion would be 0.4 cm. And I hope you all got the correct answer here. So as previously said, the code series which starts with 114 are for benign lesion excision codes, and these codes are further classified based upon their anatomic location as well as the excised diameter. So the codes from 11400 through 11406 is for excision of benign lesion of the location trunk, arms and legs, while the codes from 11420 through 11426 are for excision of benign lesion of location scalp, neck, hand, feet and genitalia. And next we have the malignant lesion excision codes, which starts with 116 series. So we have two code ranges once again. The code series from 11600 through 11606 is for excision of malignant lesion of the location trunk, arms or legs, while 11620 through 11626 is for excision of malignant lesion of the location scalp, neck, hands, feet and genitalia. So let's have a look into the facts to remember for the excision of lesion procedure. Number one, you have to verify whether the lesion excised is benign or malignant. Next, code for each lesion separately. Third point, code according to your body area. Re-excisions during the post-op, you have to use a 58 modifier. And finally, the simple closure are bundled into excision procedure codes. Okay, coders, so these are the 5 facts to remember while coding the excision of lesions. And you know what, coders? It is time for us to do a coding exercise. So let's go ahead and look into our first scenario. Of the following answers, which best describe the procedure? Option A 12031, 11601 with 51 modifier, 11400 with 59 modifier. Option B 12031 with 51 modifier, 11602. Option C 12031, 11600 with 51 modifier, 11401 with 59 modifier. Option D 12032, 11601 with 51 modifier, 11400 with 59 modifier. A 62-year-old pale patient visits Dr. Clark, a dermatologist, for skin lesions on his right forearm. After initial biopsy, the lesion is confirmed to be malignant. Dr. Clark decides to perform an excision of malignant lesion including margins, with the excised diameter being 0.6 cm. In clinic's procedure room under local anesthesia, Dr. Clark carefully excises the malignant lesion with clear margins for histopathological examinations. The 1.6 cm wound is then closed in layers. Dr. Clark also removes a benign lesion with excised diameter of 0.5 cm from the left forearm. The resulting wound of 1 cm closed using simple interrupted sutures. Patient tolerates the procedure well and post-procedure care instructions are given. So coders, I'm going to give you 1.5 minutes to solve this scenario and your time begins now. So that is time, and you all did a great job for this scenario. This was a tricky one, but you all did a fantastic job. So let me break this scenario down for you. Okay, let's begin by looking into our inventory list. And diagnosis inventory, we have malignant skin lesion of right forearm and benign skin lesion of left forearm. While in procedure inventory, we have excision of malignant lesion of 0.6 cm performed, a layered closure of 1.6 cm performed, and an excision of benign lesion of 0.5 cm performed. So keeping that in mind, I would say option B is incorrect. You know why? Yes, option B is not coding for an excision of benign lesion. And as per the guidelines, we have to code for each lesion excise. And I know that code series starting from 114 is for excision of benign lesion, and option B doesn't have it. So option B is incorrect, right? Now let's look at option D, which is coding for CPT 12032. So looking at the code language for 12032, I can see it is for repair of intermediate wounds. It has extremities, and it is for a repair length of 2.6 centimeter to 7.5 centimeter. Now again, cross-checking with my procedure inventory, I see that we had a layered closure of only 1.6 centimeter and not 2.6 to 7.5 centimeter. And that makes option D also incorrect. The correct CPT code should have been 12031, which is for a repair intermediate of extremities 2.5 centimeter or less. Right? So option D is also incorrect, and now we are left with option C and option A. So option C is coding for 12031, 1160000 and 11401. So 11600 is for excision of malignant lesion including margin, trunks, arms or legs excise diameter of 0.5 centimeter or less. And again, let's cross check with procedure inventory. I have an excision of malignant lesion of 0.6 centimeter performed, not 0.5 centimeter or less. So that also eliminates option C. The correct answer then would be option A, that is coding for 12031, which is for repair of intermediate extremities 2.5 centimeter or less, and 11601, that is for excision of malignant lesion of trunk, arms or legs. Excised diameter would be 0.6 centimeter to 1 centimeter. And finally 11400, which is for excision of benign lesion of locations trunk, arms or legs, and excised diameter of 0.5 centimeter or less. Yes, so option A is the correct answer. You all did a fantastic job. This was not an easy scenario, but you did a fabulous job.
Okay, time is up! We hope you have enjoyed class. Don't forget to like and comment underneath this post and share if you feel inspired to. Also, please take a moment to complete our survey in the chat. Your instructors should be sharing the link, and you can always find the survey in the description of this video. On behalf of the team at AMCI, thank you. So long for now. Until next time.
4,000 exam passers and free classes at AMCI. Learn to code straight from home or on the road at